Hello, and thank you so much for joining us for this edition of Healthline 3. I'm Carly Flynn Morgan. Today we're talking about the topic of gastroenteritis with Dr. Paul Bracey from Urgent Care of Louisiana. He will be answering your questions for the next half hour, and we want to encourage you to ask what's on your mind. If you're online, just click on the orange Healthline 3 box halfway down the right side of your screen, type in your question and submit it, or just give us a call. The number is 318-219-4569. It's right there at the bottom of your screen. We'll be taking your questions until 12:30 today. Thanks so much for being here, Dr. Bracey.
Thank you.
So this is kind of an embarrassing thing to talk about. It's kind of a messy topic, if you want to say that. And it's a long word, but just tell us what gastroenteritis is.
Basically, all that really means is inflammation of the stomach lining and the intestinal wall. So the gastro is the stomach, enteritis is intestinal. So it's a combination of the two. Sometimes the one aspect of it is more prominent than the other aspect. So, the term gets thrown around for any kind of inflammation of the intestinal tract.
So when people say, I have a stomach bug, is that what it is, gastroenteritis?
That's what they're describing, and most of these are viral illnesses. Over 90% of the time, they are norovirus is the culprit that's most commonly associated with it. Sometimes you can get a bacterial infection, and those don't necessarily need to be treated with antibiotics, unlike bacterial infections elsewhere in the body. Many times those infections won't be treated as long as they're not invasive.
You mentioned norovirus. That is something that's been in the news a lot lately with those nightmare cruise ships where people, I think like half or 75% of the people on those cruise ships got sick with norovirus. It must be something that spreads pretty easily, right?
It does spread pretty easily, and also the thing with norovirus is it will stay on surfaces for a good period of time, sometimes up to a couple of weeks. So unless the surface is vigorously cleaned, you can come by and catch it, a good bit later.
We do have a caller at this point in time. Sybil has a question for Dr. Bracey. Thanks so much for calling us, Sybil.
Hey, Sybil.
You there?
Yes.
You can go ahead and ask your question to Dr. Bracey.
I'm 78 years old and I have diabetes and a slight high blood pressure. Back in the first week in December, I got sick, diarrhea and vomiting, and I tried my home over-the-counter remedies, which I had, and they did not take care of it. And so I went into the quick care and was given an antibiotic. And but I've just found out recently that I ran across the bottle and found that antibiotic said that if I had diarrhea as a result of it, then I should contact my doctor. And I got all of this cleared up, and now I just have gas that I can't control, and it's controlling me. I'm fearful to even get out of the house. The gas is so constant.
Well, I think there are probably a couple different issues here at hand. One is what the original intestinal infection was and its response to the antibiotic. And then also another issue is the fact that many antibiotics do cause diarrhea, and many just as a side effect of the medication. And some antibiotics, if not all antibiotics, are associated with actually making you more likely to contract a second bacterial infection called C. diff, or Clostridial difficile. So it kind of becomes problematic as far as following and determining what we need to do. And if you needed that antibiotic for the diarrheal illness to begin with, and that made all the diarrhea go away, then some of what you're experiencing may be just kind of recovery from that, and the fact that it has altered the healthy bacteria that normally live in your intestinal tract. One way to try to combat that is by taking something called a probiotic. Now, you can get them over the counter. There are some that are prescription, but the idea is to try to reintroduce the healthy and bacteria, and to kind of promote the growth of the healthy bacteria for you, to kind of eliminate the ability for other bacteria to come in. If you're having a lot of gas and distension, that can be, there are several things that can do that, but that may be that you've got a bacteria in your intestine that's kind of just producing those gases, and that probiotic may help. It may help eradicate that, assuming all the diarrhea is gone. Is all the diarrhea, all that over with?
Yes, it is, and it doesn't seem to. This has just gotten worse in like the last 3 days, and it doesn't seem to make a lot of difference what I eat. I tried, to be careful about what I eat, and that doesn't seem to make any difference. It's just like I can't even leave the house. The gas is so bad, and I had earlier bought this Mylanta gas, anti-gas medicine, maximum strength, and I used those yesterday, and of course this morning I haven't eaten anything but breakfast, and so I haven't had the gas today, but is it something that I should go in to my doctor to see about, or
is it painful?
No, it's not painful. It's just that this gas there's just appears to be nothing there to stop this gas at all. It's just like you turn a faucet on and it just flows, just time after time after time.
And I assume we're talking about gas from below and not belching or burping a lot. Is that?
Oh, no, just gas from below, passing from below.
It sounds like you may have eradicated some of the healthy bacteria that help kind of control the gas-forming bacteria, and that probiotic may be of benefit. There's nothing really wrong with taking something like Mylanta gas or any medication that has simethicone in it, which helps reduce the amount of gas in the intestinal tract. But if it's becoming painful, or if it's escalating in problem, then you may need to recontact your primary care doctor, especially based on your age and being a diabetic. They want to stay on top of your health issues. So if the over-the-counter remedies like probiotics and gas medications like Gas X or Phazyme or whatever one you like to use are not helping, then there may be a culprit that can be kind of figured out, usually not for gas, usually not on stool sampling, but at least keeping your primary care doctor in that loop, so they can kind of help guide that treatment plan. Because if it fails, then there may be another option, like sending you to the gastroenterologist to discuss. But if the diarrhea has resolved and you're not having any more of the loose stools, or then that would suggest the original infection's over and that you're not really having the bacterial complication of antibiotics, that C. diff, but that more likely you're just kind of that antibiotic. Not only did it eradicate the bad stuff, but it also eradicated some of the good stuff. And so you want to try to reintroduce the good bacteria, and the probiotics are usually a good way to try to do that.
Okay, well, I appreciate it very much. Thank you.
My pleasure.
Sybil, thanks so much for calling. Dr. Bracey, how do you know the difference between just a regular upset stomach and something more serious like gastroenteritis?
Well, in most cases, gastroenteritis are not particularly damaging or a high risk kind of an illness, although if you're someone who is easily prone to dehydration, they can be. There's some people have had certain types of abdominal surgeries and things that make them more likely to develop dehydration in the face of a stomach bug, so to speak. The severity of the symptoms typically, the ability to hold oral intake, the volume of fluid loss, all of these can kind of suggest whether or not you need to have that next step. And if it's something where in say a young healthy person, if you're getting dizzy when you stand up, if your pulse rate's elevating, if you know these things are happening, what's going out is more than what's coming in, then it may be time. It's time to kind of get that checked out. And in older patients or in patients who take certain medications, it can slow down that pulse rate, and so you'll have an artificially normal pulse rate. So you may not be able to use that as a strict judge on whether or not it's time to get IV hydration. But one of the simplest things is if you're getting kind of dizzy when you stand up, then that suggests that your blood pressure is not able to accommodate. You may be a little low on blood volume.
Good information there. We do have another caller at this point. Anderson has a question for Dr. Bracey. Hello, Anderson. Anderson, you there? Henderson. Okay, sorry about that, sir. Go ahead and tell us your question.
The question is, I'm a diabetic. I have diabetes too. And I'm having those same symptoms that the lady is having. I've had them for the past 5 days now. And I'm like she has gas, I'm having it, but sometimes it's as if I can taste the bowel up in my throat. And I'm having trouble just passing the symptoms. And what's happening is I'm scared to expel gas because I have no control. So that's my problem.
Yeah, and you know, I guess another thing that I really didn't mention with the prior caller is if there's any change in your medication regimen recently, especially as it pertains to the diabetes. If you're on certain oral medications, they can give you these GI symptoms. If you can try and I will say, if there's not been a change in your medication, there's not been any other change in your underlying health status, and you're not having a lot of nausea, vomiting, and diarrhea, then what we're looking at is probably not a gastroenteritis, as we would kind of talk about in the context of this presentation, and maybe more of a side effect from any of the medications you're taking, or it could just be a little transient gastritis as well, which can happen with certain types of foods, can be infectious, medications can cause it, so it kind of depends on if there have been one thing would be, or have there been any changes to your medication regimen recently in the past, say, 2 to 3 weeks?
There's no changes in the medication. Although I do take all the diabetic medications and everything, I take the insulin in the morning and the Vascessa at nighttime, 1.8 milligrams of that. So other than that, there's no changes. I'm just concerned about, do I need to get I think you call it, start with a P?
The probiotic?
Yes.
It shouldn't hurt. It won't hurt, and it may help. It kind of depends. Probiotics tend to be more useful if you have somehow had the intestinal bacteria that are good, what we call the normal intestinal flora, eradicated by typically a round of antibiotics, and that's usually where that problem comes into play. It could be antibiotics taken any time in the past few months. It doesn't even have to be a recent round of antibiotics, and many antibiotics are associated with that phenomenon. So you may get some benefit using something like a probiotic to see if it helps, using some nausea medicine or an antacid. There are certain antacids that you want to be careful with depending on what medications you already take. They can affect absorption of other medications. But if you're symptomatic and you're having a lot of that, like you mentioned, kind of that acid taste, that almost reflux kind of a symptoms from above, as well as the gas, then that may help too. That may just be what we term dyspepsia, which is kind of a broad symptom, really not a specific diagnosis, or at least not a specific culprit. And a lot of times these acid reducers can help those symptoms. It doesn't sound like what you have is infectious,
okay.
But so you may respond to other kind of non-infectious treatment plans. One thing we always worry about with diabetics, especially, is gallbladder a gallbladder infection and things like that. If you're not having pain, you're not having fever, you're not having nausea and vomiting, then that also sounds like that's probably not related to it. But you may try the probiotic, and you may try an acid reducer, and I wouldn't do it, not as a permanent medication change, because you really want to talk to your primary care doctor before instituting any of those kind of permanent changes. But that may help and give you some relief on a temporary basis. But again, I always encourage patients, keep their primary care doctors in the loop. The primary care physicians know you and know you best, and if you are experiencing a new change, and we frequently at our clinic at Urgent Care will forward results to primary care doctors. We'll, sometimes even if we need to, we'll talk to them on the phone and let them know what's going on with their patients. So, so we're firm believers in keeping the primary care doctors involved too.
I appreciate it, Doctor. It just started when I did the Miralax, so because I was getting constipated and I was scared that I didn't want to stay constipated, and I took the Miralax. I've taken it before, but yet still, after I took it this time, I just lost control of everything.
Well, that medication in particular can do that, and if you stop the then what the best answer may be is just stop the Miralax, don't add anything new, and give it about 2 or 3 days and see if it resolves on its own. So that way you're not giving yourself another medicine to kind of disrupt the system more.
All right. Well, I certainly appreciate it, Doc. It's been a pleasure talking to you, and thank you for the information.
Well, thank you for the call. I appreciate it.
Henderson, we hope you feel better.
Yeah. Well,
thanks so much. So once you get gastroenteritis, doctor, how long can someone expect from the first day until they feel totally better, back to normal?
Depends on the bug. I mean, a lot of people understand the concept of the 24-hour stomach bug. So sometimes just within a day. That's usually a viral thing, a non-invasive viral infection. So there are some infections that can last a couple of weeks. So it depends on the particular pathogen involved. But for the most part, usually within 2 or 3 days.
If it's been determined that someone in your house or in your family has gastroenteritis, what do you need to do to clean your house and the surfaces to make sure that it doesn't spread? You really, that's a good question. I mean, you really do need to pay attention to hygiene. Hand hygiene is one of the most important aspects of it. Wash your hands. The person who's infected, wash their hands. Have them wash their hands, and you try to limit them to one area of the house. If you have multiple bathrooms, try to limit them to one bathroom, let everybody else use another one, trying to prevent cross-contamination. And then cleaning the surfaces. A bleach solution is wonderful. It's inexpensive, and can be used to wipe down the countertops. Most things will be killed with the other agents like Pine Sol, the antibiotic hand sanitizers. However, norovirus is not all that responsive to those, and a lot of times it takes that kind of more thorough bleach cleaning to eradicate. The callers wanted to know some things about different medicines, over-the-counter medicines they were taking. Is there any sort of medicine over the counter or otherwise that can help treat this, or do you just have to let it run its course? No,
there are some over-the-counter medicines that you can use. For nausea, you can try something like Dramamine, which is typically a motion sickness medication. It may give you a little bit of benefit. I think many of us, I don't know about most of us, but many of us will have some extra, prescription medicine like Phenergan or something, or Zofran or something like that we have in our cabinets. Loperamide or Imodium AD can help slow down the diarrhea associated with it. So there are some good over-the-counter medications that will work. Now, if you have a non-invasive gastroenteritis, then loperamide is fine to take. If you have an invasive illness where there may be blood associated with the output, fever, then you usually don't want to use those medicines alone. That can increase the risk of complications associated with stomach infections. I use the word stomach kind of loosely, but intestinal infections. So especially with bacterial culprits. So certain things in children, something called HUS, or hemolytic uremic syndrome, that can occur as a result of infection with certain strains of E. coli. And you can get bacterial overgrowth in the colon and something called toxic megacolon with bacterial.
Toxic megacolon sounds awful. That
it
sounds terrible.
It's a pretty severe illness. So there are some complications that can arise from using motility agents alone in invasive disease. Now, luckily, most cases are not invasive. And if they are invasive, then they're, depending on the bacterial culprit, either a single dose of an antibiotic can help eradicate it in the case of something like traveler's diarrhea, or a 3-day course if it's something that's a little more aggressive.
Yeah, good word there, aggressive. So how do you find a balance between trying to stay hydrated and obviously if you're throwing up at other things, you might not even be hungry or thirsty. My mom always said when you had an upset stomach, try to drink ginger ale. So is there anything that you should eat? Should you try to force yourself to eat and drink? How does that work?
Well, food is probably not as important as fluids.
Okay.
So, and there are certain types of fluids that are more easily absorbed by the intestinal tract. Things like Pedialyte, it's not just for kids. Adults can use it as a hydration fluid. It's great. It absorbs rapidly. And helps provide some of the things that you need when you're battling the bug. The things that contain sugar in them, such as like regular Gatorade, I think Powerade has a lot of sugar in it. I'm not familiar with it myself, but things that have sugar in them can make the diarrheal illness worse. You probably want to avoid dairy products. In a lot of gastroenteritis, you'll get a transient problem with the ability to break down the sugars in dairy products, so you get a little lactose intolerance that is short-lived. It's not permanent, it's transient, but can make digestion of that worse and can make the diarrheal illness worse. So, but you know, hydration is the biggest key. You know, we can go quite a while without food, even though we may not want to, but the fluids are the ones that will get you in the end if you don't keep up with them.
How many people do you see at your urgent care with this issue a day, and is there any particular season or time of year where it gets worse?
Well, it depends on pediatric and adult. For pediatrics, everybody who has kids has heard of, if not experienced, the rotavirus. So, you know, rotavirus is easily spread among children, especially in daycare environments, and is usually limited mostly to children. Adults can catch rotavirus, but we tend not to because we've already had it, and we tend to wash our hands before we put things in our mouths, unlike, you know, a 2-year-old. So we tend not to get the rotavirus as much. Our virus is more of norovirus, but I forgot what the original line of questioning was.
I think I just asked, how many patients do you see at the urgent care?
Yeah, well, it depends. It does kind of follow a seasonal kind of a pattern usually. I mean, norovirus we're seeing a lot of this season. We've probably seen 1 or 2 patients a day, you know, with this, and at the peak we would see maybe 4 or 5, sometimes 6 a day with it as well. So, and it will come out, and it will kind of come out in communities. In groups of people, you know, I mean, and then kind of wane. So it tends to wax and wane a little bit in presentation. Now, the one thing about this norovirus is that it was a novel strain. You know, norovirus has been around forever. There's nothing new about norovirus as a virus or as a culprit, but this strain is one from Sydney, Australia, and has kind of introduced into our population and is relatively new, so has caused more illness than maybe you would normally see.
It's something that's unpleasant, obviously, but relatively common. But if you don't get the proper treatment or do the right things, if you get this type of infection, I mean, can it be potentially deadly?
Yeah, it can. It can be. And depending on the offending culprit, the agent, it can be. So, you know, and especially if you have underlying health problems such as heart disease, congestive heart failure, kidney problems, kidney failure, then if the dehydration is allowed to go too far, you can actually cause irreversible kidney damage. So there are problems with dehydration. Now, with some of the more invasive organisms, like Salmonella, Shigella, then those can seed the bloodstream and you can become septic. So there are problems with the more rare causes of gastroenteritis, the bacterial causes, that can be life-threatening.
We talked a little bit about how the neurovirus falls under this particular category, and you can get that from different surfaces. We talked about cruise ships. You hear a lot about people getting a stomach bug from different types of food. Does salmonella fall under this type of thing?
Yeah, it sure does. It sure does. Salmonella is a culprit for a bacterial cause for gastroenteritis. Salmonella, Shigella.
You can get that. People always hear about that from poultry.
Salmonella, yeah, you can get it from poultry. You can actually catch it from reptilian pets that you have in your house, like turtles. So those can serve as sources for infection. Most of these are the bacterial culprits are due to the foods that we eat that may be prepared not ideally. So the idea of peel it, cook it, wash it, or leave it alone. If somebody is preparing food and didn't wash their hands well, then they may pass that on into the food stream. So,
if someone is dealing with stomach illness time after time, is this something where certain diseases can get confused with this? IBS kind of comes to mind for me. Or are there certain things, people that they could think they have gastroenteritis, but it could be something more serious, possibly?
Well, there definitely are. There are inflammatory diseases of the intestinal tract. There are functional problems with the intestinal tract, like IBS. Inflammatory bowel disease, like Crohn's or ulcerative colitis, can sometimes be confused by lay people. So there are other culprits, and so when symptoms persist beyond the expected time frame, when they don't quite meet the usual pattern, that's when you start to suspect these issues. Rarely, do you suspect them straight off the bat. And then other things, if you have focal abdominal pain or abdominal tenderness, then depending on the location of the pain, you may worry about things like appendicitis. You may worry about gallbladder disease, diverticulitis. So there are other things that need to be thought of, that need to be in the abdominal cavity, that need to be addressed or investigated.
Are there any certain members of the population who really have to watch out for this? The young, the old, some of the callers had diabetes. Should anyone be particularly vigilant about this?
Well, I think everybody should be vigilant about it. Everybody should concentrate on keeping their food clean, keeping their hands clean, but as far as kind of comorbid illnesses, people who already have kidney trouble, people who have heart trouble, people with impaired immune systems like diabetes, can do to your immune system. And then, the very, very young, infants, little babies, they can become dehydrated very easily.
Before we go, let's just go over one more time the signs that you should actually go to an urgent care, go see a doctor rather than just stay home and try to ride it out. Well,
if you're presuming that what we're treating is gastroenteritis, then dizziness on standing, feeling thirsty, unable to quench that thirst, having more out than you can put in, these are good, strong reasons to go consider IV fluid management. If you are not having those symptoms, then oral management is the way to go, oral hydration. So, and then if it's not, then a focal abdominal pain would argue against gastroenteritis and argue for another culprit that needs to be addressed.
All right, very good information. And really quickly before we go, we have about 45 seconds left. I'd like to talk about your mustache because this is new today. You've been growing it in March, and people may want to support you in what you're doing. Tell us about that.
We are raising a campaign. We have a Facebook campaign where Dr. Walcott and some of the other guys in the clinic are growing facial hair to raise money for Providence House. So this is not my usual thing. I'm pretty pathetic at growing facial hair, but so I'm not afraid to get on TV and embarrass myself a little bit.
No, it looks good. It does.
But we're raising awareness for Providence House, trying to raise some donations for Providence House through our Facebook page and through our clinic.
And that's Urgent Care of Louisiana?
Urgent Care of Louisiana.
Facebook page.
Facebook page.
Very good. Dr. Bracey, thanks so much for being here with us. Everybody, have a great day.
Thank you.